Hi there, welcome to my YouTube channel, welcome to my nursing channel. My name is Nurse Master Charlie, and if you are interested in nursing, health, education, and maybe a little bit of music, nursing education music, then be sure to subscribe, like this video, and then click on the notification bell so you can be made aware when I make new videos about nursing related topics.
Normal blood pressure is defined as less than 120 over 80, and blood pressure is measured in millimeters of mercury.
This video is going to be about blood pressure and how to take a manual blood pressure. This is part of a little series of videos I'm doing about vital signs. The first video I did was a general overview about vital signs. I'll put a link in the card here and somewhere, and then I'll put it also at the end of the video so you can click on that if you're interested in watching that. And also, for all you nursing students out there, I'm going to be putting an NCLEX or a nursing certifying exam type of a question towards the end of these videos. And what I'm doing is asking the question, and then I'll give you the answer and the rationale in the next video. So, the last video I posed this question. You are caring for a 4-week-old infant, and during your assessment, which findings would require immediate intervention by the nurse? A. Abdominal respirations. B. Irregular breathing rate. C. Inspiratory grunt. D. Increased heart rate with crying. E. Nasal flaring. F. Cyanosis. G. Asymmetric chest movement. And H. Presence of the moral or startle reflex. So what was your answer for this question? And in the NCLEX style, the answer was select all that apply. So here is the answers, because there's more than one. The answers are C, inspiratory grunt, E, nasal flaring, F, cyanosis, and G, asymmetric chest movement. Now with C, grunting occurs when an infant attempts to maintain an adequate airway, so that's not normal. E, nasal flaring also occurs when the nostrils are widening to bring in more air, also not normal. And F, cyanosis, refers to a bluish discoloration which indicates hypoxia, which is not normal. And G, asymmetric chest movement, occurs when the abnormal side of the lungs expands less and lags behind the normal side. This is also not normal. So there are your answers. I know you got them all right. And if you didn't, just kind of research the rationales on those so that you can be prepared if you were asked a similar question like that on that exam. So keep watching. At the end of this video, I'll present another NCLEX type related question. So like I said, today's topic is on that of blood pressure. But before we get into the actual skill, let's talk a little bit and review about vital signs. What are vital signs? Vital signs are a group of physiologic measurements about life-sustaining or vital functions of the body. So to review, the 4 primary vital signs are temperature, pulse, respirations, and blood pressure. With the 5th and 6th vital sign could include pain, oxygen saturation, and in some places they will include level of consciousness, height, weight. And again, before we get into the skill of blood pressure, let's talk about what is blood pressure. Now, blood pressure is the amount of pressure in the circulating blood against the walls of the arteries in the body. So to make it really easy to explain, think of blood pressure like the waves hitting the shore. When the waves are really crazy and strong, think of that as high blood pressure. When the waves are medium to kind of mellow, think of that as normal blood pressure. And when there are no waves and the ocean is not moving, think of that as low blood pressure. Now, blood pressure is usually expressed as a fraction, usually some number over some number, or it could be left to right, some number next to some number, depending on what book you're looking at or what monitor you're looking at. So the fraction is basically expressing the systolic blood pressure over the diastolic blood pressure. But what does that mean also? Systolic blood pressure is the maximum amount of pressure during one heartbeat or one contraction of the heart. It's when the blood is being sent out into the circulation. And the diastolic pressure is the minimum amount of pressure between 2 heartbeats. This is when the heart is at rest. And if you want to get technical, that is actually 1 cardiac cycle. Now, blood pressure is measured in millimeters of mercury. That's little m, capital H, little g. So when you take a blood pressure, you're going to need 2 main things. One is going to be a stethoscope, Second, you're going to need a blood pressure cuff or a sphygmomanometer or sphygmomanometer, however you want to say it. And like I said, the blood pressure is a measurement of the systolic blood pressure over the diastolic blood pressure. But there is another reading to give us another type of blood pressure, and it is called the MAP, or the mean arterial pressure. Have you ever heard of that? You will see the MAP displayed on an automatic blood pressure machine. It usually shows the blood pressure, the MAP, the pulse, sometimes the temperature, and sometimes the oxygen saturation level, the SpO2. And that mean arterial pressure is an important measurement that accounts for the flow and the resistance and pressure within your arteries. MAP is considered perfusion pressure, and this is the type of pressure that is seen by your organs. And our organs need and want perfusion of blood, because without perfusion, your organs will have organ failure and they will die. The MAP allows for an evaluation of how well blood is flowing through your body and how well it's actually reaching your organs. So now I'm going to throw out a formula that you might see, especially working in the intensive care units or the intermediate critical care units. This is the MAP formula, or the MAP equation. Now, to calculate MAP, or mean arterial pressure, you're going to take your cardiac output and multiply that by your systemic vascular resistance. It's MAP equals CO times SVP, and that's going to give you your MAP. Now, most people do best with a mean arterial pressure between 70 and 110. Anything much lower or higher can be a sign of some type of underlying problem. A low MAP, or mean arterial pressure, can be an indication that a patient needs either fluid volume, they might need blood volume, and or they may need some type of vasopressor such as dopamine and or dobutamine to basically constrict those arteries to raise the pressure. If a patient has a high mean arterial pressure, then we need to do some type of vasodilation with medications such as nitroglycerin. And once they stabilize the mean arterial pressure or the blood pressure, then they can work on finding the underlying cause that is affecting either it to be low or high. I just wanted to share that because sometimes you will see a mean arterial pressure and now you have an idea of what it actually is. So let's get to the skill part of taking the blood pressure. First, you want to perform hand hygiene. Make sure your hands are clean.
Wash your hands, everybody. Everybody, wash your hands.
Obtain your equipment. Remember, you want to make sure that the cuff fits the patient perfectly. You don't want a big cuff because a large cuff is going to make the blood pressure be low. And if you did a small cuff, it's going to make the blood pressure be high. Next, you're going to need your stethoscope. Now, your stethoscope may come with a chest piece that is two-sided. One side is going to be the bell, one will be the diaphragm. The bell side is going to pick up the lower frequency sounds, and the diaphragm will pick up the higher frequency sounds. So, if you were going to use the bell on a blood pressure is more in the lower frequency sound, but you will still pick it up with the diaphragm also. And remember to introduce yourself, provide privacy, and remember to ask the patient, is it okay for you to take their blood pressure? So when you're asking your patient if it's okay to do their blood pressure, also ask them, are there any contraindications for you taking a blood pressure on whatever arm you choose? For example, if you notice that there is a peripheral IV in their arm, then don't use that arm. Or if they have a PICC line in that arm, then don't use that arm also. But you are not gonna know without asking if they haven't had, or if they've had a mastectomy where they did lymph node removal, if they have some type of dialysis access, and or maybe they've had some type of a stroke or a CVA where they don't really use that arm, and the circulation is going to be a little bit more diminished in that area. You want to make sure that their back is straight, that their feet are flat on the floor, not crossed, as this can alter the blood pressure, and then make sure that their arm that you're going to be doing their blood pressure is going to be level with their heart, whether it is supported with a desk, a bedside table, or your arm holding them, suspending their arm up for them. Now, this is kind of difficult in the hospital setting because they're usually laying down. And it's also difficult in the outpatient setting because normally, think about this. When you go to your doctor's office or your provider's office and they call you back, they walk you back, get your weight, sit you in the chair, take your blood pressure, and then you sit there and wait for your provider. you want to make sure that the patient has been sitting or resting for approximately 5 minutes to 15 minutes, depending on what literature you read. That way your blood pressure can be at maybe more of its normal baseline versus you walking right in from the lobby or whatever. And also, why do we care about if their feet are flat on the floor versus their legs are crossed at the ankles or at the knee? Well, this can actually increase their cardiac output, which is going to stimulate their blood pressure. So just a word to the wise. First, we're going to want to find either the radial artery or the brachial artery. Okay, so first think of the anatomical position where basically the arms are flat to the side, the palms facing forward. And the radial pulse is going to be on the lateral aspect of the arm, the outside of the arm, at the wrist area, and it's going to be on the thumb side. The brachial artery is going to be on the medial aspect of the arm, right about, or the inside of the arm, right about at the folds of the arm, or the antecubital fossa area towards the inside. And the blood pressure cuff is basically going to be placed about 2 inches right at the fold or the crease of the arm. So now that we know where our radial artery is and our brachial artery is, we are going to estimate what our blood pressure is. First, without using a stethoscope, we're going to put the cuff around the bicep area. We're going to palpate our brachial artery or our radial artery. We're not using the stethoscope yet. We're going to pump up the cuff until we obliterate the brachial pulse or the radial pulse. That means where we don't feel it, or basically where we don't feel it anymore. And what we're going to be doing is watching the gauge on the blood pressure cuff as we're feeling the pulse. And as we feel the pulse diminish to where we don't feel it anymore, to give us an estimation of what their blood pressure is. If it said, for example, 100, then we're going to pump up, when we use the stethoscope, the blood pressure cuff to about 20 to 40 millimeters of mercury higher than the 100. And the reason we're doing this is so that we don't miss the accuracy of the blood pressure due to something called the oscillatory gap. This is where when we release the valve, when we're checking the blood pressure, we may not actually hear the systolic or the top number immediately until the numbers start, or the blood pressure starts decreasing, then we actually will hear it. We may actually miss it. Maybe somebody's blood pressure is, for example, we pumped up the blood pressure cuff from 100 to 140, but if we didn't know that and we crank it up to 130, then we're going to miss some type of a sound when we're listening for the blood pressure. And after we've obtained by palpation our estimated blood pressure, we want to wait approximately about 30 seconds to give the arm a rest before we actually take the real blood pressure with the stethoscope. Now, I've been in the medical field a long time, and I don't believe I've really ever seen people do that. That is the correct way. Most people will do where they take the patient and they pump up the blood pressure cuff to about 180 to 200 millimeters of mercury. But if their blood pressure is 200, 210, 220, like as in a hypertensive crisis, you will miss that. And with the stethoscope, what we're listening for through the earpieces is something called the Korotkov sound. That is the thumping that we're hearing in the earpieces as we're listening for the systolic blood pressure, and then it diminishes, giving us our diastolic blood pressure. After we've done all that, we want to make sure that we tell the patient what their blood pressure was, and then answer any questions that they may have, whether is that a high blood pressure, is that low, is that okay, whatever their question may be. And then we want to clean the equipment according to your facility's policy, perform hand hygiene, and then document the findings in the patient's chart. If the blood pressure is high or low, make sure that you notify the appropriate provider. Now, general normals for newborns is 65 over 45. 1 to 4 years of age is 90 over 55. 5 to 12 years of age is 100 over 60. And the adults should be less than 120 over 80. Now, blood pressure can be categorized further as in normal, elevated, hypertension stage 1, hypertension stage 2, and then hypertensive crisis. And let me put up the criteria for that. Now, normal blood pressure is considered less than 120 systolically and less than 80 diastolically. Elevated blood pressure, 120 to 129 systolically and less than 80 diastolically. High blood pressure or hypertension stage 1 is defined as a blood pressure of 130 to 139 systolically or 80 to 89 diastolically. High blood pressure or hypertension stage 2 is defined as a blood pressure of 140 or higher systolically or 90 or higher diastolically. A hypertensive crisis is usually higher than 180 systolically and or higher than 120 diastolically, and that requires immediate attention. So why do we care about hypertension or high blood pressure, and why is it one of the vital signs? Well, it can cause damage and narrow the arteries, leading to things like aneurysms. It can cause damage to your heart, leading to coronary artery disease, an enlarged left heart, heart failure. It can cause damage to your brain, leading to a transient ischemic attack or a TIA. It can lead to a stroke, dementia, or cognitive impairment. It can cause damage to your kidneys, leading to kidney failure and dialysis. It can cause damage to your eyes, leading to retinopathy or blindness. It can cause sexual dysfunction. So you can see high blood pressure can cause a lot of problems for the body. So it's good that we monitor, that way we can treat it. On a side note, you may be asked to obtain a patient's orthostatic blood pressure. Basically what you're going to do is take the blood pressure of a patient and their pulse rate in the supine position, laying face up, sitting, and then again standing. But why? The reason: a significant change in both of these vital signs signifies hypovolemia or dehydration. This will be defined as orthostatic hypotension. The way we're going to do this is we're going to have the patient lay down supine for 5 minutes, and then we're going to take their blood pressure and their pulse rate. And then we're either going to have them sit and take their blood pressure and their pulse rate, and then we're going to have them stand and take their blood pressure and pulse rate. Some places will do this at the 3-minute mark, some will do it at the 1-minute mark, some will do it at the 3-minute mark and the 1-minute mark. Now, somebody who is positive for orthostatic hypotension has a drop of 20 millimeters of mercury in their blood pressure, or an increase of 20 beats per minute in their pulse rate. Now, this is a normal occurrence for the blood pressure to decrease a little bit and the pulse rate to increase to compensate for that. But a 20 millimeter drop in blood pressure or a 20 point increase in pulse rate is an abnormal finding. So if you're ever taking somebody's orthostatic blood pressure and pulse rate, you want to make sure that they're either on a tilt table where they have some type of support, and or if you're doing it, maybe you have somebody with you helping you just in case, because if their blood pressure is going to drop, they may become dizzy and lightheaded and actually pass out on you. So now I'm going to demonstrate how to take a blood pressure. But please take into consideration that I already have performed hand hygiene, identified the patient, provided privacy for the patient, identified myself to the patient, let the patient know what I'm going to do as far as their blood pressure, and then also ask the patient if that's okay. And while I'm doing this, I'm going to be looking for signs of contraindications as far as an IV line, for example, and getting information from the patient if there are any contraindications that I am not aware of. Here I have my patient. I am examining the arm for any signs of contraindications like peripheral IVs, PICC lines, dialysis access points, using the fold of the arm as an anatomical landmark, and then locating the radial pulse, which is actually on the thumb side of the arm. Now, the blood pressure cuff actually has markings to help guide you as to using the left arm or the right arm so that you can apply it over the brachial artery on the correct side. Put it on our arm, about, we said, 2 inches above the crease of the arm. And here I'm applying the blood pressure cuff to the patient's arm using the Velcro to secure it. Now, the blood pressure cuff should be snug, but not too tight, not too loose. Approximately 2 fingers should be able to slip under the blood pressure cuff comfortably. So once I have the blood pressure cuff on my arm, I'm basically going to find my pulse. I'm going to use my radial pulse here, or either your brachial pulse. Here I am locating the brachial pulse, and I'm going to choose to use the radial pulse, and I'm going to pump up the cuff until I obliterate the pulse to where I do not feel it any longer. And I am not feeling it at approximately 100 millimeters of mercury. Now, make sure when you use your stethoscope that the earpieces are facing forward, right directly into the ear canal. I'm going to take my stethoscope, put that in my ears, And then basically what I'm going to do is put the stethoscope on the brachial artery, pump up the cuff, and then I'm going to release the valve so that I can get the reading of the blood pressure. Now the estimated palpated blood pressure was approximately 100 millimeters of mercury. So it is recommended to pump up the cuff approximately 20 to 40 millimeters of mercury above the palpated blood pressure. And here we can auscultate the blood pressure to be about 100 millimeters of mercury systolic with a diastolic of approximately 60 millimeters of mercury. It is recommended to decrease the cuff at approximately 2 millimeters of mercury per second. And once you have obtained the blood pressure, now you want to make sure that you let the patient know what it is and then document it in the patient's chart or the electronic health record. So in this video, I've shared what a blood pressure is, what is a mean arterial pressure, and then what are the classifications of hypertension, a tidbit about orthostatic hypotension, and then how to take an actual blood pressure. So if you found value in this video, make sure that you subscribe, like this video, and click on the notification bell so you can be made aware of when I release new videos. So now it's NCLEX question time. So at a community health fair, a client has a blood pressure of 160 over 96 millimeters of mercury. The client states, "My blood pressure is usually much lower." The nurse should tell the client to A. Get a recheck of blood pressure in the next 15 minutes. B. Check the blood pressure again in 2 months. C. See the healthcare provider immediately. D. Visit the healthcare provider within 1 week for a blood pressure check. And E. Maybe take a second blood pressure medication. This isn't a check all that apply. This is just check the one answer. The answer will be provided in the next video along with the rationale and another NCLEX type related question. So the next video is going to be another vital sign related video. So I thank you for watching. God bless, and until the next video, bye bye.
Pressure that's left in the arteries when the heart is at rest is called your diaphragm.